would like to share with you a research project that really changed my life. 15 years ago, we started training Head Start directors from across the country in a program that was sponsored by Johnson & Johnson. And slowly, year by year, I got more and more involved in that program and really started appreciate the cause for which this director work, which is taking care of families in the lowest income bracket in the United States. So by talking to them over the years, I realized that the major barrier that this director faced in the access to health care was the lack of knowledge that the parents had about health care and the lack of time and not coming to any training program. So I sat down with Johnson & Johnson and we decided to create a pilot study on training Head Start parents how to better take care of their child needs. And the results of the pilot study were unbelievable. We had 4 agencies across the country. We trained 400 parents. We used a low literacy book called What to Do When Your Child Gets Sick. And we really saw very impressive results. First of all, and most important to me, the parents feeling so empowered after this training. The parents not rushing to the emergency room. We really saw a huge decrease in emergency room visit and clinic visit. The parents feeling so self-confident. So we really had both type of outcome, economical ones because we could really measure healthcare cost reductions and an impact on the families, which for me was the most important one. Based on these results, we created 4 years ago the Healthcare Institute, and we are going to train this year 10,000 families across the United States. We are in 40 states, and we cover all the ethnicities. And through this training, we're really hoping to make a difference in these family lives. After this phase, when I will be really able to conclude that this program is efficient through statistical analysis, I'm planning to try and roll it out to different other partners. I have some states that contacted me, like the state of Kansas, who wants to launch this program for the whole state. And I have other funders that are also interested in trying to implement this program because all of us need more information on healthcare, and definitely people who are very low income, who don't have the time to go and be trained, and who do take the time for this program, and on whom we really have an impact. I feel that through this project, this is a wonderful way for me to get back to the community and to make a difference. And this project touches my heart, and I'll continue working on it because I really believe in it. I have a lot of statistics on this program because I really created very strong assessment tools. We have assessment of the parents in their knowledge and behavior before the training and after the training. And we also have tracking tools where we really followed parents before and after the training in their visits to the clinics, visits to the ER, number of school days missed, number of work days missed. So the major trends that we see is really a change in behavior. The parents who 60 to 70% of the time run to the clinic and to the ER for a 99.5 temperature, for example, change completely their habits after the training, and this 75% becomes 20%. And what we really see happening is that they use the book as a first reference, and then they have the necessary tool to decide if they do need to run to the ER. Obviously, for a 99.5, you do not need to run to the ER. We've also been able to measure global number of ER visit and clinic visit before and after the training, and we've seen the same trend from the pilot study that started with 400 parents to 10,000 families that we have this year. The trend is just reinforced year by year. Now, the fact that the Healthcare Institute has been going on for 4 years, I've also collected long-term data to make sure that these parents do not forget the training after a year and go back to their old habits. And we definitely see that the decrease in ER visits and clinic visits really stays low. What we also measured is the decreasing number of school day missed and work day missed. The parents being more knowledgeable don't just keep their children at home for the wrong reason, and they have better tools to decide. And we've seen more than 40% decrease in number of school days missed, which is such an important part of school readiness and having the children ready for school. We've also seen a 50% decrease in the parents missing work days, which gives such an important stability to these parents who already have a hard time keeping the job. These are the main statistics. Johnson & Johnson came to Professor Al Osborne from the Price Center 15 years ago with the idea that they wanted to help the Head Start community. And thinking what would be a good way to help the Head Start community was the realization that the Head Start directors really needed management tools to manage their schools and to be more efficient. So we started the management Johnson & Johnson Fellows program, where every summer we have between 50 and 100 Head Start directors from across the country coming to the training. We are going to reach actually this week the 1,000 Head Start director. And I started teaching in that program. At the beginning, I was teaching an hour in that program. I teach about 20 hours in this program. So this allowed me to get to know these people, to keep in touch with them over the years, to listen to the important cause that they're fighting for. And that's how I realized that they had such a big need in helping their parents to be able to be better informed on healthcare.